Well, back again with us this month is Erie County Health Commissioner Dr. Gail Burstein, and this week is actually the month of April is National Public Health Week. That's what this week is. So I can assure you that it's a very busy week for our doctor. We have a lot of things to cover because every day this week means something else. So good morning. Nice to have you with us.
Yeah, good morning.
Busy time of year, huh?
Yes, but we're celebrating all the great work that public health does for our community. And, really, most people think that, health is determined by access to a clinic or our behaviors, which is all true. But really, the driving force that predicts most of our health are what we call the social determinants of health. So these are really of assets of wealth or consequences of poverty, like access to safe housing and healthy housing, access to safe and healthy foods, access to good education and safe schools, access to transportation so you can get to a good job or a good school. So those are really all what really predicts our health. And so the health department, we wanted to highlight programs that really will help the community get better health through eliminating those threats. So first, we have a very robust lead prevention program because lead is a neurotoxin, and if young children are exposed during their peak of their brain development, they can get irreversible effects that can affect their ability to learn, it can impact their behavior, and cause ADHD. And so we have new enforcement regulations now, and we're taking actions working with our Erie County DA to make sure that landlords make the repairs they need to keep the homes safe from lead.
Right.
And we will take them to court if need be. We also have classes to help homeowners understand how to make lead-safe repairs to their homes, so again, they won't expose their family. We have a very sophisticated public health lab. We do a lot of water testing. We monitor the water quality in the beaches, make sure that people aren't exposed to bacteria when they swim. We can test water for lead in people's homes. So we're testing our lakes for the toxic blue-green algae. So we really want to keep people safe with their drinking water. We also have programs to help people who are struggling with opioid addiction get connected to treatment. And so we have our Erie County Addiction Hotline, 831-7007, where people can call and get information, and they can even make an appointment for a long-term provider. And we're also working with our emergency departments. All the emergency departments pretty much in the community can start people who come in and are have an opioid use disorder on a low-dose prescription of Suboxone. And if people are uninsured or underinsured through the county, we have funds to help them to pay for that week's prescription that will get them through until they have their first appointment with a long-term treatment provider, which is usually able to be done in like 1 or 2 days.
Amazing.
So those people walk out with a prescription, their first appointment with a Suboxone provider, and then a dose of Narcan that the county provides, and linking up to a peer. So we're really trying hard to help people have healthier environments and really address the social determinants of health, which are that are a big driver of poor health.
And of course, smoking and tobacco use cessation. You're there for people with that.
Right. So if you remember at the end of last year, we were able to pass legislation, a new law, so pharmacies can no longer sell tobacco. And the state, we hope is going to, we hope the governor is going to sign the T21 law that will limit sales of tobacco to people 21 years and older, because we know that tobacco is so addictive, especially electronic cigarettes have such high nicotine content, and teenagers with developing brains become addicted much more quickly if they're much slower doses and shorter duration compared to adults.
All of these programs available to you through the county. All you have to do is get in touch. Some of the others, STD prevention and treatment.
Right. We have a great STD clinic at 608 William Street where we can do like top of the line STD testing, treatment. We also offer family planning services. Again, money is not a barrier. We can cover those costs if people are uninsured or underinsured. And in New York State, we have a great New York State insurance marketplace. So we can hook people into a facilitated enroller, and they can walk away with health insurance.
That's wonderful. All of this is available through the county. And the things we haven't even mentioned yet, immunizations, the lead exposure prevention, water systems and safety, and everything is available through, again, our Erie County websites and through social media, okay? So really, this week is National Public Health Week, and we want you to know, that all of this is available right here through Erie County. So anything you might need, all you have to do is go to these addresses, and there's somebody there who can help you. It doesn't matter what you make, doesn't matter how you're insured, we're going to help you. And I love that. Thank you. Sure. Dr. Gail Bernstein, everybody. All right, we're going to take a quick break and come right back.